Hi, this is Dr. Schmoe. Welcome to the FNC Brain Injury and Concussion Recovery Summit. What we're going to talk about now is ocular motor function and fast eye movements or saccadic eye movements. These are very important eye movements for building maps and letting you know where your body is in space. So with concussion and head trauma and other conditions such as dizziness and vertigo, triple PD, even MDDS, patients that have had stroke, brain trauma, PTSD, it is very common to have changes in the way that your fast eye movements move to hit targets to build a good, accurate representation of where your body is in space. So a lot of saccadic eye movement integration basically happens in the brainstem as well as in the cortex. So you have premotor areas in the frontal lobe, and those fire down into areas in the brainstem that activate generators to allow you to produce fast, accurate, quick eye movements. And when you're producing fast, accurate, quick eye movements, that helps you basically develop appropriate maps of where you are in relationship to everything around you. So if you're looking around a hockey arena or if you're driving, you're not just keeping your eyes fixated. You're moving from fixation and then moving your eyes, and you're picking up targets, and you're doing it very, very consistently. Hundreds of thousands of fast eye movements being done on any given day. And when patients have head trauma, it really seems to affect these networks that are involved in the brainstem and in the brain, and that can lead you to have a lot of symptoms with cognition, feeling brain fog, just feeling off in general. So we use technology in our clinic to assess saccadic eye movements, not only in a stationary position, so having you look left and right, but then we'll use a variety of other different types of strategies. One of them is called an anti-saccade. So we might bring a target up and have you not actually look at the one that we flick, but you're going to pick up the other target. We might have you just scan through our office to see if you can localize objects in space. We might see if you can do what's called more anticipatory saccades, if we actually give you sound. So we can do sound localization saccades. We can have you saccade to different parts on your body to see if you can map out your body appropriately. And then we like to use a device called saccadometry. And saccadometry, the one that we use, is from a company called Interacoustics. We also have other saccadometry from a company called Ober in Poland. But with this technology, we can look at latency, velocity, accuracy, and so the precision of where your eyes are actually hitting on target. Different areas of the brain can affect saccades differently. So the latency, how quickly you can actually get started, a lot of that has to do with changes in the frontal lobe firing down and through the basal ganglia. So if we saw changes in your facial expression, your affect, your mood, if you had slowness of gait, if we're doing finger tapping and it's really slow, and if you have a hard time doing what's called dual tasking activities, and if you combine that with the increased latency of your fast eye movements, we would think that maybe there's some changes that are going on in your frontal cortex. And we can prescribe a variety of different exercises that would target that area of the brain. We can also look at the accuracy. So basically how close you are landing on the target. And that tells us about different areas of the brain, such as the cerebellum. If you're landing short of the target or you're hypometric, there could potentially be changes in what's called the ocular motor vermis. It's a specific area of the cerebellum, and that's a very midline area of the cerebellum that integrates with spine, eyes, and shoulders and hips. So we might say, all right, well, let's check the coordination of your shoulders and hips, not just distal extremities or finger tapping. And then we can develop different eye movement activities where you're doing things with your body to allow you to basically activate that area to get you to land closer to the target to build accurate maps of where you are in space. And then you can have changes in the trajectory. So instead of landing on the target, you might kind of like slide in. You might have what's called the glissade, and that has to do with the cerebellum. So we're going to take a look at your coordination, rapid alternating movements, look for gait ataxia, your speech, so the way that you're speaking. Do you have any changes in coordination of your movement, gait, wide base gait? So we take a lot of other findings from your exam and then we put it together with what we see with your fast eye movements. Almost everybody that we see at our office at the Functional Neurology Center in Minnesota have slow eye movements when they have a lot of brain fog. And when you improve those fast eye movements, not only at this depth, but adding in vergence and close, far, people seem to feel a whole lot better and they feel less foggy and their cognition seems to come back online. So we like to develop fast eye movement strategies to activate regions of the brain that became dysfunctional with your head trauma. So we use it as an indicator to help us figure out where we need to do rehab. And then we can combine that with other types of strategies like low-level laser or cognitive tasks or adding in visual vestibular integration. So vestibular strategies in addition to using fast eye movement strategies. And that seems to work really well with helping speed up recovery in our patients. So you can also have asymmetry of your fast eye movements between left and right. So say if you're slow looking over towards the right, maybe there's some issues going on from the cortex on the left firing down into the brainstem, into the burst generators and the pontine regions to get your eyes to be able to move quickly over to that opposite side of your world. So it can tell us about this kind of hemispheric type findings, not only in the cerebellum, but also in the cortex. And we combine everything together with a good, physical exam, gait analysis, chiropractic exam, looking at the cervical spine, looking at testing cognitive function in addition to checking Saccades. So Saccades are just one test that we do and integrate it with multiple other functions. And just in general, for fast eye movements, horizontal is going to be more lower in the brainstem. Looking at more vertical eye movements, so vertical and torsional, there's integrators. It's called the rostral interstitial nucleus of the medial longitudinal fasciculus, so the RIMLF, and the interstitial nucleus of Cajal. So there's different names for these different regions that can actually become dysfunctional. So we see a lot of force enter into that upper brainstem when people have head trauma. And that will change the way that your eyes track and move in the vertical plane. And if you have changes in the way that your eyes are moving in the vertical plane, that is going to change your posture and your activation of your muscles in that AP plane. So say if you have a really tight neck, changes in your pec minor, it's tight all the time, you're getting thoracic outlet syndrome, we want to not only adjust and do manual therapies and craniosacral type movements, but also go in and start to activate these generators to help build better eye-brain-body integration. Another cool strategy that we like to use is actually doing gait with Saccades. So having people walk slow, walk medium speed, walk fast, and move their eyes as they're moving. And we can do that with a treadmill as they're hitting the Dynavision D2. So they might be walking on a treadmill as they're hitting targets. And we might do cool things like, let's have you step off the treadmill on flat. So your brain is going, all right, I was moving, now I'm not moving, now I'm on a flat surface. Get back on the treadmill, keep hitting the targets. You might be doing some dual tasking, and then we have you jump off the treadmill onto a Bosu ball, stabilize on the Bosu ball. You might still feel like you're still moving, and that will change and integrate into areas of the cerebellum that need to tell you if you're moving or if you're not moving. So you need to know if you're moving or if you're not moving, if your eyes are steady, and you need to be able to hit targets with your eyes all day long. And when that becomes dysfunctional, you will develop a lot of brain-based fatigue. So if you're interested in getting your eye movements assessed, we can set up a consultation. You can reach out to us at thefnc.com. We would love to speak with you, and hopefully we can figure something out. If we can't, we're going to point you in the right direction of people who can. So we would love to work with you, and thank you for joining us on the FNC Brain and Concussion Summit.